I want to extend warm greetings to our colleagues in the University of Utah. The collaboration between the two institutions started somewhere in 2005. I met Professor Jeff Peters and then Dr. Devon Hill somewhere around 2005 when this collaboration started. Professor Jeff Peters is an anesthesiologist, just like myself, so he approached us for a collaboration. At the time, the Department of Anesthesia had just about 5 doctors, and only 2 were specialists. So Professor Jeff Peters have really helped the department to develop over the years. First of all, he started an update in anesthesia conferences, which brought together anesthesia providers from all over Ghana to Kumasi. And that also grew the interest of medical students in anesthesia. I remember the then class, the final year in 2005, established what they call the anesthesia interest group. And Jeff will bring residents from Utah to motivate the medical students in Ghana to take interest in anesthesia. And today, from 2005 to 2025, we have over 100 doctors in the department. And that is one of the greatest achievements of the collaboration between University of Utah and then University of Science and Technology.
What I remember about the Utah SMS, can I call it connection? I don't know. It started when I was dean, and I was introduced to Utah by a former classmate of mine who was the Minister of Health at that time. He was Dr. Richard Alani. He was the Minister of Health at the time I was dean. And he introduced me to Utah because he thought the opportunities that the Utah's University School of Medicine could offer us in the teaching and research was very promising, that we should explore it further. We got to meet, and the leader of their delegation at that time was one of the nicest people I've ever met in my life, Dr. Devon Hill. We got on very well, and then he decided that they should come and help us with our teaching and research. So it moved on from there, and they used to come to the medical school to help teach, and they even expanded the way they operated, because they helped various departments in the school. Like anatomy was helped, then the medical lab technology was also helped, and they used to bring lecturers who would help in upgrading these departments. And through the Utah School of Medicine and through the Devon Hill, we also help with community health to establish what is now a university in the Kpong area, that's in the eastern region. So I would, in summary, I would say that it was a very good experience. Our interaction with the Utah School of Medicine, they've helped us so much, and they continue to help us with advice and sometimes even with collaboration in Barikuma, that is a village not too far from Kumasi, where they've set up a training place, and they bring their students in, and then they interact with our students. So I mean, it's been a very positive interaction with Utah.
In the Division of Public Health, I've had the opportunity to come to Ghana since 2002, when I first came with Dr. Devon Hale and met Dr. Chiri Abanyega, who at the time was the Dean of the School of Medical Sciences. This has given our students an opportunity to partner with experts here in Ghana who understand the complexities, the disease patterns, and the needs of communities, while our students have the opportunity to come and learn from their counterparts, from community health workers, and from faculty here at KNUST. They then return home and are able to influence their counterparts in the community, in healthcare delivery, and in public health to make and improve our health in ways that they learn from their Ghanaian counterparts. It has been particularly insightful to see the growth of the students as they experience the interchange, the camaraderie, and their understanding improves in respect to challenging resource-limited areas and how communities address health when resources are limited. That principle of understanding enables them to make better decisions and improve not only their health, but the health of the community around them.
In the long run, one of them got stuck to first, that Professor Bradford Rockwell. He has been coming to for the past 13 years. Every year, on average, he will come once. We hold programs. And then, through his efforts also, students go to Utah, our medical students who go for elective, and they spend 6 weeks there and have some hands-on in the University of Utah Medical School in Salt Lake City. And he comes in with residents to acquire more skills in surgery in the theater. And we also will sending some of our surgeons there, like my assistant, Wet Williams, others. I also visited the Fifi, Youngson, I may call a number of them, Zinav, and a number of them, they visited the Rockwell over there just to see, observe what others do outside Ghana in the field of plastic and reconstructive surgery.
We started as an exchange of medical students with the opportunity to learn and to participate in the education of medical students. Shortly after that, when Dr. Ansong joined the crew, it expanded to public health. And since that time, we've been focused on improving the public health education here in the new school of, well, it's not so new anymore, in the establishment of the School of Public Health here at KNUST, as well as advancing the program of public health at the University of Utah.
I think that this occasion is a very good occasion to celebrate our past excellence in academic research, and to showcase what we have done. And we thank you all for supporting this endeavor. A little background, we have within the collaboration at the Study Abroad program, where we have students from KNUST and students from University of Utah co-research into community health issues. And within the past 20 years, I can estimate that we have had over 300 University of Utah students come to partner with over 400 KNUST students into research in rural communities, specifically in the Barekese district area. We're continuously having this collaboration, and this year we're happy to say we have students coming and we're still collaborating. We believe that the next 20 years is going to be another years of excellence in academic research.
I'm grateful to be participating in the 50th anniversary of the Kwame Nkrumah University of Science and Technology School of Medical Sciences 50th Jubilee. I began working in Ghana with KNUST in approximately 2008, and we have produced a copious amount of research that has informed Ghana Health Services regarding allocation of resources and the quality of the health services that they offer these communities. At the same time, this has afforded both tech students and Utah students an opportunity to get deep experience in community-based participatory research, public health research, research regarding epidemiology. These programs have been absolutely formative for our students, and many of these students have gone on to do master's degree in public health, PhD in health sciences, MD, MBCHD programs. It has simply been a fantastic program.
School of Medical Sciences is actually the bedrock, or let me say, is the parent for the School of Dentistry, because without the establishment of the SMS, there wouldn't have been anything like a school of dentistry, because we get a lot of support from School of Dentistry at Utah, the collaboration. Our program is a 6-year program, but the first 3 years, all our students are taken care of by the School of SMS.
I have been a beneficiary of the SMS Utah University collaboration. I went to Utah in 2012 as a resident in neurology. And although Utah was very cold, the weather was quite cold, the reception was very warm. And I benefited from the experience of learning neurology, training in neurology, research, as well as patient care. And this has really helped me as a lecturer in neurology, and this has strengthened the collaborations that has existed between KNUST and Utah University.
So we in ophthalmology have had a long-standing partnership with the University of Utah through the Moran Eye Center. Indeed, our relationship goes back 25 years. We have benefited immensely from that relationship that we've had with the Moran Eye Center, which is under the University of Utah. Our collaboration with the Moran Eye Center has led to a lot of benefit in terms of human resource development, exchange programs where we send our consultants to the university and they send theirs to us. We send our residents to them. Through our relationship with them, we've also developed contacts that has resulted in one of the best eye centers in West Africa, and thus developing the environment that is really optimum for teaching of medical students and postgraduate students in ophthalmology.
I met Professor David Morton about 20 years ago. That was in 2005 when he visited the Department of Community Health with the then Dean of the School of Medicine, University of Utah. Being a human anatomist, he immediately took interest in the anatomy department and wanted to know how they could collaborate with us and also help us improve upon our teaching and learning in the department. At the time, he was made aware that we had over 150 medical students per class. And he, at that time, thought that he had never taught a class that big. He had never taught a class with more than 70 medical students. So he immediately took interest in what we do in the department. We had several discussions with him then, and we finally concluded that we were going to collaborate along 3 lines. First was to develop computer-assisted learning tools in anatomy to improve or enhance learning of anatomy in the department, and also stimulate the students to learn more anatomy. Secondly, we wanted to extend this to our postgraduate training in the department, and then finally also do some research which was based on computer learning tools in anatomy, and to extend that to the other medical schools in the country. We benefited a lot from the University of Utah. They've helped us in so many ways. We've even had some of our postgraduates visiting Utah so that they could have some exposure to their teaching labs and also to the sort of research that is done in their department.
I entered SMS in 1987 and I completed in 1993. On the 50th anniversary of SMS, I send congratulations to SMS, and I am so excited about the legacy project which we want to give to the school.
So I was Vice Dean just before my retirement, and we started planning for the SMS at 50 during my tenure as Vice Dean. So now we are running into it. It's a year-long program, and we are almost to the tail end of the program. Now I'm the chair of the LOC, so we put all these things together and put together all the committees and the programs. And I'm the founding president of the SMS alumni. I started the journey for this alumni quite some time, more than 10 years ago. We got to a point and it collapsed, so we picked it up again. And then I think that now we've reached the threshold where now the alumni has come to stay. Now we have a constitution, we have a bank account, and I think that everything is now set to roll into the future for the alumni. So the reason that I picked up this alumni project was because I had a mission, and the mission was, one, to stay in the country and take care of Ghanaian children, so that's why I stayed, and then to train doctors for the children in perpetuity, so doctors will be available to take care of the children for a very long time. And then now the last bit of my ambition is now, after training the doctors, there must be an umbrella under which all the doctors will operate. Okay, in a fraternity, and that is the SMS alumni. So this is actually the last bit of my ambition, that once the alumni is set and all the doctors are together in one family, then I'm ready to retire. Everybody should just relax and enjoy the 50th anniversary. And we are very happy to have you all celebrate with us. Thank you all.
The University of Utah is an extremely proud partner of KNUST and has been over the past over 20 years in this collaboration. We look forward to continuing this collaboration as it improves both the capacity, the understanding, the outreach, and our ability both here in Ghana and in the United States to improve the health of our communities and to improve the health of those around us and our families.
I wish the two institutions the best, and then we are praying that this collaboration will grow in the next 20 years, the next 50 years, to help our two institutions.
SMS at 50, congratulations.
I thank everyone and wish you everyone all the best in our practice to lead this medical school at this stage.
And may this celebration bring a lot of blessings, academic progress, and integrity and growth to both School of Medical Sciences and also the University of Utah. Thank you.
Long live SMS, long live University of Utah, and long live all the schools that SMS has been able to mentor.
I want to thank the faculty, the staff, and the students from KNUST for welcoming me and my colleagues and our students to Ghana for all of these years and allowing us, in one small way, to participate in improving the health of rural and peri-urban Ghanaians.
We want to say a big thank you to our colleagues, particularly David Morton, Susan Stances, and Bo Foreman in the Department of Anatomy, University of Utah, and also to all our students who have assisted us throughout these 20 years in developing all these virtual folders for the younger generations to use.
The University of Utah is very fortunate to have an excellent partner in KNUST. We are grateful for the opportunity to partner with our collaborators here, and we look forward to a continued successful partnership. Thank you. Medase pa.